Hello, welcome back. All right, ready for lymphatic system part 2? Yay! Of course you are. How can you not be? All right, so let's begin. I'm going to hide myself so you can see the pictures better, and let's get going. All right, so as you probably saw in that image from last video, our lymphatic organs and different tissues are widespread throughout the body, which makes sense because, again, one of their job, right, is to absorb the extra fluid. So anywhere there's blood vessels, we're going to have lymphatic vessels and lymphatic organs, as well as they're going to be there for immunological surveillance. So again, anywhere where you possibly could get a cut and some sort of infection traveling through your bloodstream, you're going to have lymphatic organs there trying to make sure that, again, they're going to catch that as soon as possible. Okay. We have two general categories. The first are what are known as primary lymphatic organs. So primary lymphatic organs are the ones that are going to provide the environment for stem cells to divide and mature into B and T lymphocytes. So that's the key there. So primary lymphatic organ is basically where our B and T cells are going to be born and mature. Okay, and then here we have sort of the subcategories. And then the thymus is where pre-T cells that are born in the red bone marrow mature. So basically all of these cells are going to come from bone marrow. However, the B cells will mature in bone, and then the T cells are going to mature in the thymus. So B for bone maturation, T for thymus maturation. Okay, hopefully that'll help you remember where they're coming from, or well, I guess where they're maturing. Again, they both come from red bone marrow. And then secondary lymphatic organs is basically where the immune response is actually going to occur. So these are the places like lymph nodes, the spleen, as well as lymphatic nodules. And again, remember, lymphatic nodules, very similar lymph nodes, except they don't have a connective tissue outside. All right, so again, the thymus, that's a primary lymphatic organ, lymph nodes, spleen, and then the nodules, those are all secondary lymphatic organs. Okay, again, meaning primary, where they mature, secondary, where the immune response is going to occur. So here in this image, you can see the thymus right here. It sort of sits right above the heart in that mediastinal area. Very large organ in infants, but it gets much smaller by the time you hit adulthood. Sometimes like late into adulthood, it even converts completely into connective tissue. I've got a link here for a Radiolab story. That's really interesting. So again, one of the jobs of the thymus is to be a site where these T cells are going to mature. Now, when we say they mature, part of what's going on is that these T cells are created in the red bone marrow. They travel to the thymus, and in that maturation process, your body basically weeds out the ones that aren't doing what they're supposed to, or I suppose more accurately, in theory, that's what your body's supposed to do. So basically, your body is going to select the ones that, for example, don't respond to chemical signals. So if they're not responding to like, hey, you should be activated now, they get killed off. Or if they respond inappropriately, they get killed off as well. So theoretically, your T cells should not attack you, and any of those T cells that do attack you should be getting killed off. Now, obviously, this doesn't always work. We have autoimmune diseases and stuff like that. However, that's theoretically what that maturation process is supposed to do. This Radiolab story is really interesting. When you have time, take a listen to it. It talks about how because this lymphatic organ is so much bigger in infants than it is in adults, they thought that at one point it was a cause of sudden infant death syndrome. They thought it crushed the trachea. You can see the trachea, the windpipe in babies, like if they were laid on their backs in the cribs. So that's why they told parents for a very long time to lay babies on their stomachs. And then it goes even beyond that to where they actually tried to irradiate thymus glands in babies, like I think it was in the 50s or 60s, and like the rise in even in breast cancer in women as a result, and like the damage it actually caused those people who had that done to them as babies later on in life. So anyway, it's a really interesting story, and when you get a chance, take a listen to it. Let's take a microscopic look at our thymus gland. Oh, come on. So we have an outer area called the cortex, and then a medulla. So this whole thing is our thymus gland, and then it has these lobules, so you can kind of see this pink border around it. That would be a lobule. That lobule has a cortex. Cortex is the outer part, that darker sort of bluish purple, and then you have this inner, more pink part. The trabeculae it's simply connective tissue kind of separating sort of lobules of that thymus gland. All right, so in this cortex, what we're going to find are a large number of T cells. So these are these immature T cells. They haven't matured yet. They've just gotten there from that red bone marrow. And they're going to also divide there, and they begin that maturation process. In that area as well, we have dendritic cells, and they're called dendritic cells because they, remember back to dendrites, like in when we talked about the brain and neurons, remember dendrites, they kind of like stuck off the cell body, they were these little arms that came off. Well, dendritic cells are essentially monocytes, but they're not just a round kind of shaped monocyte, they have these little like projections coming off of them. And those little projections are going, well, not the little projections, but the actual dendritic cells are going to help those T cells mature. And if that T cell is not responding properly, that monocyte can then gobble it up and get it out of circulation before it keeps dividing, and now you have a bad, T cell that attacks you. We have epithelial cells as well as macrophages. Again, those epithelial cells are going to do something very similar to what the dendritic cells were doing. So they're also going to help in that maturation process. So they're essentially there to help select out the T cells that, again, are not responding properly to different cues. So again, either they're trying to attack you or they're not responding at all. So again, those epithelial cells will help weed those guys out. And then the macrophages are there to clean up any kind of debris left over. That's housekeeping. All right. So that was in the cortex. So in the medulla, so as we're getting from the edge toward the middle, now we have these mature T cells. We still have the same epithelial, dendritic cells, and macrophages, but we also see something else called Hassel's corpuscles, and these are epithelial cells, and they actually don't really know exactly what these Hassel's corpuscles or thymic corpuscles are. You can see it in this image here. However, they think that it's a site of T cell death. So some of the T cells mature, they make it all the way into the medulla, and those epithelial cells are like, yeah, you're still not doing what you need to be doing. We're going to kill you off, and that's kind of what that's what T cell death looks like right there. All right, so here's a sort of a typical lymph node, and one of the things to note here, so here's our little kind of bean-shaped node, and they really do look like, I don't know, like black beans maybe, about that size. And what you're seeing is that vessels lead into them from multiple areas. They'll have to, and then whatever that lymphatic fluid is, will have to go through this cortex, through a medulla, and then back, through these different vessels. And then what we're going to see is that as that fluid kind of trickles through all this space, it's going by T cells, dendritic cells, B cells, macrophages. So again, if there's anything in that lymphatic fluid that's, a foreign microbe or something, your lymph nodes will pick up on that. Okay. So that cortex, we'll see that there's an outer cortex and inner cortex. So again, kind of outer cortex, inner cortex. Okay. And then we have the actual medulla in here. So outer cortex, inner cortex, and then the medulla. Right. In that outer cortex, we have B cells, and what we'll end up seeing is that these B cells are going to be the ones that produce antibodies. We'll talk more about that when we talk about the immune system. So if you look at the lymphatic nodule, so this little area right here, and if you end up seeing that most of these cells are B cells, we call that a primary lymphatic nodule. And you can see this. So after B cells in that area, so let's say something comes in, lymphatic fluid is flowing through here, it has some foreign microbe in it, the B cells recognize it. Now B cells will actually transform from what's a B cell into like into what are cells called plasma cells. You see that right here. It's a plasma cells, and it's that plasma cell that is the active form of the B cell that's actually producing the antibodies. So I don't know. It's like Clark Kent becoming Superman or Bruce Wayne becoming Batman, right? So that B cell is kind of just hanging out, but then when trouble comes, right, they turn into sort of that superhero that's then going to fight off the bad guy. That's my analogy. That's all I got. Anyway, so and then once it's fighting off the bad guy and it's transformed, we now call it a secondary lymphatic nodule. In this inner cortex area right in here, what we're actually seeing are T cells and dendritic cells, so there's none of these nodules, sort of this roundish shape. We'll see those nodules in lab as well. They're not necessarily can I put this? Then it's more like you can kind of see the cells in a cluster. Like imagine almost like what that nodule is going to look like in lab. Imagine if someone took like a photo, like an aerial photo of like a big crowd, and you can see like where people are kind of like gathering in big circles, like maybe in kind of groups. So it's still a big crowd. It's a whole bunch of people all over the place, but you can see where they kind of gathered because, I don't know, there's a street performer or something. That's kind of what a lymphatic nodule is. Anyway, point being, in this inner cortex, you don't see those lymphatic nodules. They're mostly T cells, dendritic cells, and T cells are going to be the cells that attack other cells. And the thing is, you have to have the dendritic cells there to help the T, because T cells are kind of funky. Like you could have, so again, if we're kind of just like looking at the scenario, we can have this interstitial fluid, or lymphatic fluid rather, coming through the capillary system, going through that cortex. And if there's some sort of microbe in there, that's some foreign, antigen in there, it could go right by the T cell, and T cell's like, loopy-loo, okay. It won't act if it's not already activated. It takes the dendritic cell to grab that, pathogen and actually present it to the T cell. It's got to go like, look at it, look. And then the T cell's like, whoa, I don't know how I missed that. And then it goes into action. Okay. So anyway, dendritic cells have to be present to present those antigens to the actual T cells. And then once they do that, then the T cells will activate, and then they'll start dividing, and then they'll launch and try to kill the foreign microbe. Okay, so and T cells are going to leave those lymph nodes, and they will go to the site of infection. Okay, B cells and plasma cells will not. They stay put, and the plasma cells will produce antibodies, and it's the antibodies that will go into circulation. Again, we'll talk more about that when we get to the immune system. So in the actual medulla area, so in this area, we have B cells as well as plasma cells. We have macrophages, and again, we've already talked a little bit about what they do. So it flows in one direction, afferent vessels lead in, sinuses lead to the efferent vessels, which then lead out. The hilus of any the hilus of any organ, like be it kidney or lungs or anything like that, is essentially the area where the fluids or tubes are going to enter and leave. So this would be the hilus right here. Or I guess maybe it's like a collection where tubes enter and leave. So right there. Okay. The nodes filter lymph. The vessels do not. That's another key distinction. All right, so spleen, small organ. It's on your upper left-hand side between the stomach and the diaphragm. And that's, it's not anteriorly though. It's really more toward your side. Okay, so like the diaphragm really wraps around to your back area, and it's between the stomach and diaphragm, but toward the left back side. Okay, it's much closer to the ribs. Again, the hilus is where blood vessels and lymphatic vessels enter and leave. That's what you're looking at right here. And then it has these two areas. There's the white pulp and red pulp. You can see them in the image. So there's white pulp nicely white here. And then the red pulp. The white is lymphatic tissue, so you have lymphocytes, macrophages around these arteries. And then the red pulp is where these sinuses are going to fill up with blood. So a blood sinus is basically where like the blood vessel enlarges. Okay, so basically in some of these, the blood vessels kind of empty into like a larger pool, and then it gets drained away. The nice thing with that is when you increase the surface area that way, flow reduces, and really it's there to help with basically like filtration and stuff like that, because your spleen is going to help filter worn out red blood cells, and also, as we see here with the white pulp, will help monitor any kind of microbes should they be present. And now these lymphatic nodules, so what you're looking at here are Peyer's patches and intestine. So this is the lumen of your intestine. So this is where the food would be going through, right? And this is the outer border. So they basically just kind of sliced it cross-sectionally. And you can see here these clusters of cells. Those are Peyer's patches. Okay. So again, these do not have a connective tissue capsule around them, and they're scattered. So you're going to find them throughout the digestive tract. Well, throughout the digestive tract. So you can find them in the stomach, esophagus, what have you. Lymphatic nodules, that is, I should clarify. You'll find lymphatic nodules throughout the mucous membrane linings and the digestive tract, not Peyer's patches. Those are specifically in the ileum of your small intestine. Okay, so again, places you'll find lymphatic nodules. So your digestive tract, the gastrointestinal tract, urinary tract, reproductive tract, respiratory tracts. So again, anything where you have a lumen and there's some possible microbes that can come in and try to invade your body and your mucous membranes, you're going to have some lymphatic nodules monitoring things. So again, you want to make sure you catch it as soon as possible, right, before some really bad infection takes place. Okay. And again, you saw those Peyer's patches. We see that in the ileum. And you'll also have lots of lymphatic nodules in the appendix. It's one of the reasons why there used to be this big discussion about whether or not the appendix was a immune structure, like an immune organ, or if it was a part of like a digestive organ, because it had these lymphatic nodules in it. I think pretty much now they're leaning toward it being part of digestive tract, more of playing a larger role in the digestive tract. We'll talk more about that later on the semester. Okay, tonsils, right? So there are different tonsils. So adenoids, also known as pharyngeal tonsils, the palatine tonsils, and then the lingual tonsils. We will have seen these in lab. All right. So last but not least, what can go wrong? Classic thing is something called elephantiasis. You can watch a little video on it. Here's some images. Basically, elephantiasis is spread by mosquitoes, mosquitoes that have been infected with a parasite. What happens is when the mosquito bites you, these parasites go into your lymphatic capillaries and they destroy them. So as you can kind of see in this image, particularly pronounced in this female here, so her lymphatic capillaries of both her legs were destroyed. And remember, one of the key things about those capillaries is that they're helping reabsorb fluid. And when you can't reabsorb that fluid, you have massive amounts of edema and swelling, and eventually, you can't reabsorb that fluid. It just kind of stays there, right? And then obviously, like this, causes lots of tissue damage. And you can see this individual as well, tissue damage. And a lot of times, these people will then start having secondary types of infections on, on their limbs. To prevent that, it's actually very simple. The medicine is pretty much the same thing as the medicine you give like your dogs, horses, anything like that. It's that warmer medicine that you'd give an animal would take care of these as well. It's just a simple little pill. I forget how often people have to take it. But I know there's been a big public health campaign launched in areas to try to eradicate this disease because it's very cheap and very simple. You can watch a video about it if you'd like to know more. All right. So that was it for lymphatic system. Again, this is a nice short chapter. If you happen to have any questions, please let me know. See you next time.